Have you ever pondered how the medical field would look today without the countless inventions that have revolutionized it? Imagine a world without the cutting-edge tools and techniques that doctors use to diagnose, treat, and manage diseases. It's a world where life-saving operations, disease detection, and therapy are far from the advanced state we're familiar with today. Inventions in the medical field have not just saved countless lives, they've dramatically improved the quality of life for millions of people around the globe. They've given us the power to detect diseases early, treat conditions that were once considered untreatable, and even prevent illnesses before they strike. These inventions have been the driving force that propels medical science forward, constantly pushing the boundaries of what's possible. In the grand scheme of these advancements, the contributions of some extraordinary individuals stand out. Today, we delve into the life of a remarkable inventor in the medical field, Patricia Bath. Patricia Bath, an ophthalmologist and an inventor, was a woman of many firsts. Indeed, her story is one that inspires and challenges, breaking barriers and pushing boundaries in the field of medicine and beyond. Born on November 4, 1942, in Harlem, New York, Patricia was raised in a nurturing environment that encouraged her to pursue her interests. Her parents, a housewife and a newspaper columnist, valued education and instilled in Patricia a deep love for knowledge. This love for learning, combined with a curious mind, paved the way for her future career in medicine. Patricia's journey into the world of medicine began at Howard University, where she earned her medical degree in 1968. She went on to complete specialized training in ophthalmology and laser technology, becoming the first African-American woman to serve as a resident in ophthalmology at New York University, and the first African-American woman to lead a postgraduate training program in the same field. Her passion for medicine was not just limited to practice, but extended to innovation as well. She was driven by a desire to improve the quality of life for her patients, and this motivation led her to create groundbreaking solutions in the field of ophthalmology. Throughout her career, Patricia Bath was a vocal advocate for equality in healthcare, fighting against the prevailing racial and economic disparities. She was a pioneer in community ophthalmology, a new discipline that brought eye care to underserved populations. Her commitment to serving these communities was unwavering, and her work continues to inspire many today. In the midst of her busy career, Patricia found time to invent. She held 4 patents in the United States, all related to her laser phaco probe, a device that revolutionized the treatment of cataracts. It is an embodiment of her innovative spirit and dedication to improving healthcare. Bath's career was marked by a series of inventions that left an indelible mark on the medical field. Her story is not just about breaking barriers, but also about creating a legacy of innovation, dedication, and service. Patricia Bath, a woman of many firsts, continues to inspire us to this day. In 1981, Bath's unyielding dedication to ophthalmology led to her most renowned invention, the laser phaco probe. This device was a game-changer, seamlessly blending laser technology with medicine in a way that had never been seen before. The laser phaco probe targets cataracts, which are cloudy areas in the eye lens that can lead to blurred vision or even blindness. Traditionally, removing cataracts was a complex process that could be invasive and uncomfortable. But Bath's invention revolutionized this procedure, making it faster, safer, and far less stressful for patients. The genius of the laser phaco probe lies in its use of laser technology. The device sends out a laser beam that can painlessly and precisely break down the cataract. The tiny fragmented pieces are then gently sucked out of the eye, leaving the lens clear and the vision restored. It's a process that is not only efficient, but also far less invasive than traditional methods. But the laser phaco probe's impact extends far beyond the operating room. By making cataract removal more accessible and less daunting, it has given hope to millions of people worldwide. It's not an exaggeration to say that this invention has restored the sight of countless individuals who might otherwise have been left in the dark. And let's not forget the significance of the laser phaco probe in the wider medical field. Bath's invention is a shining example of how technology can transform medicine, offering new solutions to age-old problems. It proves that with innovation and dedication, barriers can be broken down and lives can be dramatically improved. But the laser-phaco probe wasn't just a breakthrough in technology. It was also a testament to Bath's belief in the power of science to change lives. It was a symbol of her commitment to her patients and her determination to make a difference in the world. The laser-phaco probe was just one of Bath's contributions to the medical field. In the late 1990s, Bath turned her attention to a new frontier of medicine: telemedicine. With her characteristic inventiveness and foresight, she sought to use technology to revolutionize access to medical services, particularly for communities that were underserved. Bath's vision was grand. She believed in a future where distance or socioeconomic status would not hinder anyone from receiving quality medical care. To make this vision a reality, she focused on telemedicine, a term referring to the remote delivery of healthcare services. It's a practice that allows medical professionals to evaluate, diagnose, and treat patients from afar using modern technology. Bath's work in telemedicine was groundbreaking. She developed a technology that combined aspects of laser technology, computers, and the internet to create a new way to deliver medical services. This technology made it possible to perform remote surgeries, bringing a new level of accessibility to medical services. Imagine a world where a surgeon in one country could perform a delicate operation on a patient in another, all without leaving their respective locations. That was the world Bath was helping to create. What's more, Bath's work in telemedicine didn't only benefit the rich or technologically advanced societies. She was committed to making medical services accessible to underserved communities. Bath knew that for many people, particularly in rural or impoverished areas, access to specialized medical services was scarce. Telemedicine had the potential to bridge this gap, and Bath was determined to make it happen. Fast forward to today, and it's clear that Bath's work laid the groundwork for the telemedicine services we see now. The global pandemic has shown us the importance of being able to access medical services remotely, and it's thanks to pioneers like Bath that this is possible. Telemedicine continues to grow, providing essential healthcare services to those who might otherwise go without. Bath's impact on telemedicine cannot be overstated. As we continue to navigate our increasingly digital world, we owe a great debt to Bath and her visionary work in telemedicine. Her contributions have shaped the way we access healthcare, making it more inclusive and accessible than ever before. Through her inventions, Patricia Bath transformed the landscape of the medical field. A statement that holds so much truth, considering the breadth and depth of her contributions. Let's take a moment to revisit and appreciate the genius behind her groundbreaking work. Patricia Bath's first significant invention, the laser-phaco probe, revolutionized cataract treatment. This device uses a laser to precisely and painlessly vaporize cataracts, a far cry from the invasive and often painful procedures of the past. The laser-phaco probe not only made cataract surgery safer, but also more effective, increasing the chances of patients regaining their sight. This was a game changer, enhancing the quality of life for millions of people around the globe. While the laser-phaco probe was a singular achievement in itself, Patricia Bath did not stop there. She saw a broader problem in the accessibility of medical services, particularly in remote or underserved areas. This led to her second major invention, telemedicine. This technology, which uses telecommunications to provide medical information and services, has grown to be an integral part of healthcare delivery. Today, it enables doctors to reach patients in remote locations, provide timely diagnoses, and even perform surgeries remotely. In this way, Bath's invention has had a profound and lasting impact, democratizing access to healthcare on a global scale. Patricia Bath's inventions have not just changed medical practices, they have changed lives. They have removed barriers, given hope, and restored sight. They've made medicine more accessible, more equitable, and more effective. They have challenged the status quo and pushed the boundaries of what is possible. In a world where innovation is often seen as the preserve of the tech industry, it's worth remembering that medical inventions, like those of Patricia Bath, can and do transform lives in the most profound ways. They remind us that the potential for change lies not just in our devices, but in our hearts and minds, in our capacity to see a problem and find a solution. Patricia Bath's legacy is a testament to the transformative power of invention in the medical field. Her work continues to inspire, to challenge, and to make a difference, shaping the future of medicine for generations to come.